Namaste everyone. I welcome all to this session today. We are conducting PRAGNAVARIDHI lecture series by Panchajanya organization. This time, the lecture series will mainly focus on how to prepare for exams, how to attend and present the answers, tricks to remember the difficult topics, and mainly on the revision. Today's session will mainly focus on Kriya Sharira subject. The session will be useful for all the students who are preparing for the upcoming exams. As you all know, Panchajanya organization will always there for you in all the aspects like handwritten notes, recorded lecture videos, mentoring program, residential programs, and many more to go. Without delay, I firstly introduce our speaker for this session. We have Vaidya Mrinal sir, Vaidya Mrinal and Rudra Gaudar. Sir is Dean Academics, RKM, AMCH Vijaypura, presently working as Associate Professor in the Department of Kriya Sharira at RKM AMCH Vijaypura, Karnataka. Sir is NCISM recognized Chief Coordinator of Entrepreneurship Development Cell and Innovation Cell. Sir completed his BAMS from BLDAS AVS AMV Vijaypura in 2015 and completed his post graduation in Kriya Sharira from SDM Hassan in 2018. Sir has presented more than 50 oral paper presentation at various international, national and state level conferences. Published 5 papers at UGC approved journals. Sir is a coordinator of RI and ED cell and coordinator of Desha Prakriti Parikshana Abhiyan, coordinator of QCI, coordinator of academic committee and coordinator of sports, coordinator of RKM Hospital core committee. Sir is serving as director of Akila Bharata Veerashaiva Mahasabha Bengaluru, Zilla Yuva Gataka Vijaypura. Uh, his achievements are many more. Secured RGH's third rank in first year PG Kriya Sharira. Secured Best Paper Award at Ahara Mantana 2017. Ayurvedic Dietetics and Nutrition conducted at SDM Udupi held on in 2017. Secured Best Paper Award at Pranada 2023 National Conference held at Solapur on 2023. Secured Best Paper Award at National Conference held at SSCA Cuttack on 25 September 2023. Secured Best Paper Award at Kriya Arohana 2023 held at Belagavi on 6 November 2023. Secured Best Paper Presentation Award at Sankalpa 1.0 National Ayurveda Conference held at Bidar in 2025. Conducted an event named Kriya Kaushalyam at RKM AMCH Vijaypura for more than 30 students were beneficial of it. Conducted an innovative event named a Typo Comical Fusion at RKM AMCH Vijaypura. Sir is advisory committee member at Shareera Chintana National Conference on Neuroanatomy and Neurophysiology organized by MRN Ayurvedic Medical College Hospital and Research Center, Bagalkot, Karnataka. Under his mentorship, more than 50 students participated in various competitions held across the country, among which 35 students stood first in the paper presentation, poster presentations, model making, essay writing, reels making, like this in many more competitions. Sir is serving as head coach of throw, throwball team of RKM AMCH Vijaypura and the team secured first place at RGHS zonal held at Ilkal, first place at Eland and second place at interzonal held at Shivamoga. Under his guideship, two students received RGHS UG short-term research grant for the year 2025-2026. We are very fortunate to have you in this session today, sir. This is the second time we are collaborating with you. It's a blessing for us and for all the students, sir. Now you can start the session,
Thank you.
sir.
The slides are visible, doctor?
Yes, sir.
Okay. Thank you, Dr. Sneha. So, first of all, I need to thank Panchajanya for conducting such a innovative workshops or lecture series, which will be more beneficial for exam going students and for BMS students and even post graduation students also. So, before starting the presentations, let us seek the blessings from Lord Dhanvantri so that in next upcoming university examinations, let him bless us and let all the students score good marks. So, the today's topic of the presentation is Kriya Sharira made easy during exams. So, myself, Dr. Mrinal Rudragaudar, Dean Academics, Associate Professor in the Department of Kriya Sharira at RKM AMCH, Vijayapura. So, the first basic thing what we need to concentrate in during the examination is write what is asked. Don't write what you know. This stands very important because so whenever the question is asked something related to vata dosha or something related to the classification of vata dosha, student rather than concentrating what the examiner is willing or what the examiner has asked, he directly start omitting what all has been dumped into his mind. So before writing, read the question properly and write actually what they asked rather than writing what all you know, because this type of answers will where we the students will lose the maximum marks. At the end of the day, the students will feel like I have written each and every point, but then also the marks is less than 50 percentage, because the examiner will concentrate on the what the actual question is needed and what the actual answer will be expected. So before that, before writing any type of answers, just read the questions properly and then you can answer it. So this is very important. I repeat once again, write what is asked, don't write what you know. So, as today we are going to speak about the question paper pattern, and we'll focus on time distribution, we'll focus on mark distribution, and we'll focus on how to present, especially the Kriya Sharira paper. Right. So, as we all know that the Kriya Sharira paper totally consists of 400 marks, where it is divided 200 into theory and 200 into practical. So, the paper 1 consists of 100 marks and paper 2 consists of 100 marks. Combinedly they forms 200 marks. So when you move to the other component, that is practical part, where the practical again it is divided into 100, 70 and then 30. 100 marks is given for practical purpose, 70 marks will be given for your viva, and the next last 30 marks will be given for your IA, that is internal assessment. So the subtotal combinedly it forms 200 plus 200, it is 400. So the complete Kriya Sharira paper consists of 400 marks, in which for passing purpose, yeah, according to the RGHS rule, we need to take 50 percentage. That is, for 400 students should secure 200 marks. It's mandatory. Both you need to pass in theory as well as you need to pass in practical. That is, in theory for 200 you need to score 100. In practical aspects for 200 you need to score 100 marks. So the next is the next upcoming presentation will be divided into 3 categories. The first category we'll discuss is time management. And the second category we are going to discuss is important questions related to Kriya Sharira, both Ayurveda as well as modern aspect. The last one is presentation skill, which plays an important role during examinations, where the maximum students fail. Okay. The first part is time management. So the complete first paper, it will speak about only paper 1, that is nothing but one subject. So the total time taken or the total duration given for given by the RGHS is 3 hours. So let us divide that complete 3 hours into in the minutes form. That is, the total 3 hours is divided in will be adjusted as 180 minutes, and the total marks for single paper is 100 marks. So the time taken is the time given is 180 minutes and the total marks is 100 marks. The next question paper pattern. So according to the RGHS and NCSM, the question paper pattern is 10 marks, 5 marks and 1 marks. That is nothing but 10 marks are called as LAQ, long answered questions, SAQ, short answered questions, and 1 marks, that is MCQs. So as we all know that we have 4 10 marks questions. Those carries, each question carries 10 marks, that is 40 marks will be given to the 10 marks, that is LAQ, and 5 marks questions or SAQ will be 8 in number, and each carries 5 marks, that is it secures 40 marks, and MCQs are 1 in number, sorry 20 in number, and each carries 1 marks, so it gives 20 marks. So the totally 40 plus 40 plus 20, so the overall it is 100 marks. The next one is the most important thing for usually the students who are appearing first time in the Rajiv Gandhi University or under the NCISM, the question paper or the booklet pattern. So usually the question, as in previous slide I have mentioned, there will be long answered questions, short answered questions and multiple choice. As we all know that this is the booklet will be in and around 50 pages. So already the question number will be printed on your booklet number, so that the question number 1 we need to write in the pages between 1 to 6, and the question number 2 we should write between 7 to 12, and the question number 3 from 13 to 18, and the question number 4 between 19 to 24, and this is fixed. So if your answer should not exceed more than 6 pages, it might be 5 pages, the last page will be 6th page will be remained vacant, and you need to have a strikeout at the end of the examinations. So the important regarding this page is the answer related to long answer should not cross more than 6 pages, and the complete or long answers questions should be within first page to 24th page. After that, from the question number 5 to question number 12, those are 8 questions which are mainly concentrated on short answered questions. Each short answered questions carries only 3 pages. We need to write the complete answers under 3 pages itself. So these pages begins from 25 to 48th page. So the last remaining thing is MCQs. There will be 20 MCQs. So at the page of 49, we will write 10 MCQs. At the last page 50, we will write remaining 10 MCQs. So this is the most important thing where the students should follow this, and the maximum students after completion of their first examination, they will come to us, sir, I have written second question in 13th page. I have written 4th question in the first page. Sir, is there any changes or there will be a distribution of marks or I may fail? So before this, have a clear picture of where the question number 1 starts and where the question number 1 ends. So that at the top, we can write question number 1, question number 1, question number 1 until 6th page. So that at the 7th page, again, you can write question number 2. As the booklet will be given half an hour earlier to you people, so that these are the arrangements which you need to make before writing any examinations. So now let us concentrate on LAQ. The LAQ are 4 in number. Basically, LAQs are 4 in number, which carries, each question carries 10 marks. That is 40 marks will be given to the LAQs. The time for per question. So as in previous slide, we have discussed the complete 180 minutes will be there. So the time for per question is 18 to 20 minutes. For one LAQ question, we need to give in and around 18 to 20 minutes. The total time duration taken for all 4 LAQs is in and around 72 to 80 minutes. Just concentrate, time for per question is 18 to 20 minutes, and the time taken for complete 4 questions is 72 to 80 minutes. And the most important thing is don't exceed 20 minutes, even if you know everything. Because what happens, if you have read Kapha dosha, or if you have read homeostasis, if you have read respiratory system in the beautiful manner, if the 10 marks question or LAQ question is related to any of them which you have read in the good manner, So the students will be so happy and he starts writing. Even though if it exceeds 20 minutes, sometimes some students will take more than 20 minutes for single question. So that the time exceeds will eat your next upcoming questions. So be aware that don't exceed more than 20 minutes even if you know everything. The next question arises, how to split this 20 minutes or how to split this 18 minutes. So the first 2 minutes is meant for thinking and structuring your answer. So for example, the question is asked for explain homeostasis and it's in detail, or explain homeostasis and feedback mechanisms in detail with an example. So the first 2 minutes you need to think the what I need to write in the introduction and what I need to write in the body and what I need to write in the conclusion and what are the tables and what are the diagrams are required for me in these 2 minutes. In next 12 to 14 minutes, the actual writing begins. So whatever you are thinking in the next upcoming 2 minutes, you will be writing in the next upcoming 12 to 14 minutes. And the last 2 to 3 minutes are mainly meant for diagrams, or we have any tables, or we have any underlinings. Because what happens, so after completion of our periodical test or after completion of our internals, the basic complaint from the student is, sir, I have left one 5 marks question, or I have left MCQs. Sir, I have left one 10 marks question. Why it happens, because if the question is of Vata dosha, define Vata dosha or explain Vata dosha in detail. Or students, what they will do, they will start writing definition of Vata according to this author, definition of Vata according to different acharyas, and gunas according to different acharyas. So they will spend more time in writing the introduction itself. So when they come to the body, the time exceeds. So what they will do, they will skip the thing and they will move on to the next question. Or else they will start writing complete until the completion of the answer, and then they will move on to the next answer. So this what happens, it will eat more than 20 minutes. If it cross more than 20 minutes, then it will eat the next answer's time. So the each 1 minute from each answer at the end of the paper, after that is end of the 3 hours, the 10 to 20 minutes lacking will happen. So that will eat your one 5 marks question or one 10 marks question or 5 to 6 MCQs. So for that, dear students, first, before writing, think 2 minutes and structure your answer. And when you move for actual writing, exact concentrate, you will write only for 12 to 14 minutes. And the remaining 2 to 3 minutes will be for your diagram, tables, and underlining the important things where the examiner will concentrate. The next one is SAQ. The SAQs, as you all know, that they are 18 number. Each SAQ carries 5 marks. So it carries overall 40 marks. So the time for per question is 8 to 9 minutes. In previous slide, the time taken was 12 to 14 minutes. Sorry, the total time taken was 18 to 20 minutes. Here, the time for per question is 8 to 9 minutes. That's it. The total time consumed here will be 64 to 72 minutes. The in and around 70 minutes. Okay. The next is how to split this complete minutes, 7 to 8 minutes or 7 to 9 minutes. The first 1 minute, we will sit and we will recall the points, what all need to be included in the answer. The next 6 to 7 minutes, what we will do, the actual writing of related to SAQs will do. And the last 1 minute will be given for the small diagrams or mini diagrams or any underlining or any the remnant part will be there. And these 5 marks or these SAQ questions are actually the scoring things. And the one more thing we need to remember, they are time eating. So for that, we need to stay crispy and we need to finish it within 7 to 9 minutes. So if the question is asked something related to central nervous system, or if the question is asked about spinal cord, what we need to do, we need to sit for 1 minute and we need to recall what all the points should be included under spinal cord, the length of the spinal cord, from where it emerges, the segments of the spinal cord, tracks of the spinal cord with the diagram and applied aspect. Okay, fine. In the writing, you need to start it from introduction, from where it up, and we need to end at the applied aspect. In the last 1 minute, we will be having small diagrams. In next upcoming slides, I'll show you. The small mini diagrams will be there. So that will fulfill your one SAQ question. And just remember, these are the scoring questions, but they will consume more time. So that we need to so crispy while writing the SAQ questions. The last is MCQ questions. The MCQs are 20 in number. Each MCQ carries 1 marks. So the overall MCQ will contribute overall 20 marks. So the time to finish all the MCQs will be in and around 10 to 15 minutes. So you'll get very less time to finish the MCQ. So as you all know that the MCQs will be so tricky in nature. So we will attempt all the MCQs at last. So the initially what we will do, whenever we'll get the question paper, we will start writing from LAQ, and then we will attempt SAQ, and then we will write MCQ. Because one LAQ will consume 20 minutes. One SAQ will consume in and around 7 to 9 minutes. So one MCQ will consume hardly 75 seconds. So we will write these MCQs at last. We will concentrate the more hardcore substance or heart of the paper, LAQ and SAQ, in the initial stage. The next is last final buffer time. That is nothing but warning bell. The last 5 to 10 minutes. So that last 5 to final 10 minutes is called as final buffer time, where we need to revise the MCQs which we have written, and we need to complete the missing headings. So I said in the initial slides, like we should not exceed more than 20 minutes. So after sometimes there will be some time remaining for 5 to 10 minutes. At that 5 to 10 minutes, what we need to do, we need to go back, we need to check all the answers. If there is any missing point, we will write that, and we will have some underlinings wherever it is required, and some improvising in the diagrams. So in initially, if there is a question related to salivary glands, we'll have the small diagrams of salivary glands initially, small, or it might be a rough diagram also. Okay, even some rough diagrams will give you half to 1 marks. That will be helping in your scoring as well as sometimes even in the passing time. So what we will do, we will improvise the diagrams at the end of in between 5 to 10 minutes, and final touch will be given to the paper. So during the final buffering time, it will be in and around 5 to 10 minutes. We will revise all the MCQs. We will complete the missed headings and improvise the diagrams. We will improvise the sum of the diagrams, and the final touch will be given to the paper. Okay. So this is all about how the SAQs, LAQs and MCQs, the time distribution is given. And the next comes the marks distribution for paper 1. So usually, as in previous slide we have discussed about, the paper 1 consists of 100 marks and paper 2 consists of 100 marks. And there are some LAQ, SAQ and MCQs. So these are the topics which are included under Kriya Sharira paper 1, like basic principles of Kriya Sharira, Tridosha, Vata, Pitta, Kapha doshas and Dosha Vriddhikshaya. So dear students, in this we need to concentrate. There is no LAQ question in basic principle of Kriya Sharira. So we need to concentrate only short answered questions and MCQs in the basic principles of Kriya Sharira. And there are no LAQs in Tridosha. So there should be no confusion. Tridosha is a concept, and Vata, Pitta, Kapha are again separately explained in the syllabus copy. So wherever there is a S, there will be the probability of that question, and wherever there is a no, there is no answer of question from that particular component. And when we concentrate on mark distribution, so there is 8 marks will be given for basic principle and Tridoshas. So if there is one SAQ from that question, and there will be 3 MCQs from that particular topic. This pattern you need to understand before studying, and this pattern you need to understand before going through question paper. This pattern you need to understand before writing the examinations. And the next 26 marks will be contributed from Vata, Pitta and Kapha and Vruddhikshaya. So in this, there is everywhere there is a yes. This indicates we can expect LAQ, SAQ and MCQs from this particular component. So the next continuation part, there are the 26 marks will be contributed from Prakriti, Ahara, Agni, Ahara Paka and physiology of homeostasis. So for 20, to overall 26 marks will be given under these headings. And you can concentrate in Kriya Kala, there is no MCQ. So there is no worry of confusion in between the Rutu Kriya Kala, Vadi Kriya Kala, stages of Kriya Kala. So directly we will concentrate in a Kriya Kala, it might be a SAQ or it might be a LAQ. So the next 23 marks will be contributed from the physiology of respiratory system, physiology of GIT. So here we need to concentrate. So there might be a SAQ also, there might be LAQ also, because the marks distribution is 23. So there might be a long question from respiratory system and there might be a short question from GIT, or vice versa. There might be a long question from GIT, a short question from respiratory system. The remaining questions will be in the form of MCQs. And the next 17 marks will be given from the physiology of CNS and physiology of endocrine system. So these will contribute around 17 marks. So when we concentrate on previous year question papers, the maximum LAQs will be given from the part of endocrine. Like thyroid gland will be given. So last 2 years there is a repeated question of thyroid gland and its hormones and its hyper and hyposecretions. So when you move to the CNS, there will be in previous year question paper, if we refer, we have maximum SAQ questions. So by keeping these references, we can concentrate, okay, next upcoming examination, these will be the probable question. It's not like that every time the 10 marks question will be from endocrine and 5 marks question will be from CNS. In next examination, it might vary. So the 10 marks question might come from physiology of CNS and the 5 marks question will be from endocrine and the remaining questions will be in the form of MCQs. So this is about paper 1. And when we move on to the paper 2, the 18 marks will be contributed by dhatus like Rasa, Rakta, Mamsa and Meda. So there is no long question in the introduction towards dhatu, which mainly includes dhatu and dhatu poshana nyayas. So the students will be having confusion like the dhatu poshana nyaya, if it is asked for 10 marks, what we need to write. So there is no question of 10 marks question. There will be direct 5 marks question or there will be a MCQs. So when we move on to Rasa, Rakta, Mamsa, Meda, there will be 100% long answered questions and short answered questions, and MCQs will be related to the Anjali Pramana or the different opinions of different acharyas on related to respective dhatus and the upadhatus. There will be some MCQs questions. And when we move to the next part is the 19 marks will be contributed from Asti, Majja, Shukra, Ashraya, Ashrayi Sambandha and Ojas. So here we can concentrate everywhere it's S. Then it clearly tells like SAQs, LAQs and MCQs will be asked from the each and every dhatus. The next is the 23 marks. The heavy marks will be contributed from Upadhatu, Mala, Indriya, Manas, Atma, Nidra and Swapna. So it's clear like recently I got a call from a student like, sir, if there is a question of Nidra for 10 marks, what all we need to include in that? So I said, you just refer your syllabus copy. They have clearly mentioned that must known questions will be asked for LAQ. That is nothing but the Nidra and Swapna doesn't comes under must known. That is nothing but there will be no long answer questions with the help of Nidra and Swapna. So with this reference, and even there will be no long answer questions with respect to Atma also. So if you refer the previous year question papers, especially the RS7 batch, there is no such long questions related to Nidra and Swapna and Atma. We have 5 marks questions, explain Nidra, types of Nidra and benefits of Nidra. And there will be a combined questions, explain Nidra and Swapna. And there will be a 5 marks question related to Atma, Atma Lakshana or Atma Nirupana. So we can write related to the marks distribution, as it is 5 marks question or it is 10 marks question. And there will be MCQs will be available in each Upadatu, Mala, Indriya, Manas, Atma and Nidra and Swapna. So these all will contribute 23 marks. The next is the topic which are mainly related to the modern aspects. The 18 marks will be contributed from hemopoietic system, immunity and cardiovascular system. So here the other question arises, immunity. So we have this much of explanation in the immunity. So whether it will come for 10 marks, there will be a questions in during the examinations. No, there will be no 10 marks questions related to immunity as per the syllabus. We can expect 5 marks questions related to immunity, types of immunity. And when we move on to the hemopoietic system, we can expect both 10 marks, 5 marks and MCQs questions. So when we move on to the next component, the 7 marks will be contributed by muscle physiology and adipose tissue. The most favorite question by everyone is during the muscle physiology is contraction of muscle. Muscle contraction is asked repeatedly for 5 marks. So there will be no 10 marks questions related to adipose tissue, related to muscle physiology. So when we move to the next component, we are having 15 marks will be contributed by physiology of reproductive system, physiology of excretion, special senses, dreams and sleep. So these will contribute these will contribute in and around 15 marks. So here the S indicates we can expect LAQ, we can expect SAQ, and here we can also expect MCQ questions. So this is overall about the marks distribution and where we can get or where we can expect MCQs, where we can expect SAQs, and where we can expect LAQs. So with respect to Kriya Sharira paper 1 and paper 2, both Ayurveda as well as modern aspects. Then we will move to the next part of my presentation. The next part of presentation is nothing but the important topics to be focused under Kriya Sharira. So first thing is Ayurvedic part. So these are the topics which comes under Ayurvedic part, both paper 1 as well as paper 2. The first thing is basic principles, Tridosha, Vriddhi and Kshaya, Kriya Kala, Prakriti, Ahara, Agni, Ahara Paka, Dhatus, Ashraya Ashraya Sambandha, Upadatus, Mala, Indriya, Manas, Atma, Nidra and Swapna. So when you move to the basic principles of Kriya Sharira, the basic questions what we can expect during this Kriya basic principles is the relationship between dosha, rasa and ritu. We can expect only a 5 marks question from this by this RS7 batch repeated question papers. If we go on through, the basic principles will be asked only for 5 marks, and we can expect like Samanya, Vishesha, Siddhanta in this thing. So when we move to the Tridosha, the most expected 10 marks questions are Vata Dosha, its Nirukti, Sthana, Guna, Karma and Beda. Same with respect to Kapha Dosha. So when we move to Pitta Dosha, when we observed in previous year question papers, the Pitta Dosha is asked for 5 marks. And even sometimes there will be a 5 marks question related to Kapha Dosha. Explain types of Kapha Dosha in detail. Or they might try ask you like explain Sthana, Guna, Karma of Pitta Dosha and explain Pachaka Pitta in detail for 5 marks. But 10 marks we can expect Vata Dosha and Kapha Dosha. So the students mainly concentrate on Vata Dosha and Kapha Dosha for LAQ, concentrate on Pitta Dosha for SAQ. And MCQs, as usual, you can concentrate on each and every topic. When we move on to the Vriddhi and Kshaya, we need to concentrate on Vata, Pitta, Kapha, Vriddhi and Kshayas, because sometimes while writing Vata Dosha, you can include Vata Dosha, Vriddhi, Kshaya there. But sometimes what happens in 5 marks SAQ, there will be a question like explain Tridosha, Vriddhi and Kshaya Like, or they might be asked, explain vata, pitta, kapha, vriddhi and kshaya. Here we need to write or only concentrate on vriddhi and kshaya. There is no need to write the nirukti of vata, nirukti of pitta, nirukti of kapha. Directly we will start. I will show you in next upcoming slides how we need to write vriddhi and kshaya. Directly we will start from vriddhi and directly we will start with the kshaya. The next kriya kala, there is no thing in that. We have a direct question kriya kala. There will be direct question kriya kala, 5 marks question, where we need to concentrate that ritu kriya kala and vadi kriya kala. With the example, you can write and you can have small mini diagrams at the pages, so that you can finish the complete kriya kala answer under 3 pages. The next question comes prakriti. It's the most vast topic where we can expect the prakriti questions related to vata prakriti, explain characteristics of vata prakriti in detail. The many of the students at the end of the completion of our first year, so it's very tough to bahad that 8-line shlokas, very tough to bahad the charaka shlokas. So what, see, according to the NCSM rules is, we need to bahad shlokas, but bahading shlokas by each and every students will be little bit tougher. So what we will do, we will write according to Acharya Charaka. These are the characteristics related to Vata Prakriti. And you can include the 2-line shlokas which has mainly explained by Sharangadhara. So that during writing, we can concentrate, like why the examiner will concentrate, okay, the student has written the answers related to Acharya Charaka, and also he has concentrated on with the shloka by Acharya Sharangadhara. It is same related to vata prakriti, pitta prakriti and kapha prakriti. After completion of these prakriti answers, you need to write what is the utility of prakriti, why we need to study, where the prakriti is used in the diagnostic purpose, in the treatment purpose, for maintenance of swastha, or to identify the basic line of treatment, where it is used actually prakriti, we need to concentrate. And the one more thing, usually the students will have less focus or less light towards the topic is intrauterine and extrauterine factors responsible for formation of prakriti. So the intrauterine factors and extrauterine factors, like 4 plus 6, 10 factors will be there. Before starting prakriti, you need to concentrate on that topic. The next comes the classification of prakriti. Usually students will write it is a tridoshaja, so and so they will concentrate on only one part, doshaja part. Nine. So the classification of prakriti will be doshaja prakriti, manasa prakriti, and bhautika prakriti. So you need to write the classifications in the clear manner, so that it will be very easyable and eye catchy and mark scoring. And the next topic is ahara, the most important one. The most expected question are 3 here. The first expected question is avastapaka. It is 5 marks question. And the next expected question is ahara parinamakara bhava. Again, it is 5 marks question. The next expected question is Ashtavidhi Ahara Visheshayatana. Again, the same is, all 3 questions will be for 5 marks. There will be no 10 marks question. When we move on to Agni, the Agni, it is very rarely asked in the examinations. So we can concentrate, we can focus on 5 marks. The Agni, we can write the types of Agni like Jatara Agni, Bhuta Agni, and Dhatva Agni. And we can write the avasthas of Jatara Agni like Sama Agni, Vishagni, Mandagni, and Tikshnagni with respect to the doshas. When we concentrate on Ahara Paka, the Ahara Paka is nothing but the process of digestion. It's expected for 5 marks. So when you move on to the Dhatus, in Dhatus, the 5 marks expected question is Dhatu Poshana Nyayas. And when we move on to the 10 marks questions, the most expected 10 marks question is Rasa Dhatu, Rakta Dhatu, Shukra Dhatu. So when we see the previous year question papers related to RS7, the mostly or frequently asked question is Rasa Dhatu, Rakta Dhatu, and Shukra Dhatu. Remember it. And the rest of the Dhatus will be concentrated for 5 marks. And the Ashraya Shri Bhava, it's a direct question which will be asked for 5 marks. And Upadhatu, even it might come for 10 marks. even it might come for 5 marks. So there is a direct question, there is no change in that. When we move to even same as that of mala, mala is basically asked for 5 marks, and sometimes there will be a question like dhatu mala. So there should be no confusion between the students. You need to write the same shloka and you need to have a clear explanation related to mala. And the next is indriya. Indriya, it's mainly asked for 5 marks question. It is a fixed question. Indriya pancha panchaka, with code form we can form, and the tabular form, and why it is used. So in initially I said, before starting 5 marks question, we need to plan or we need to recall the points. Because what happens, especially when it comes to indriya pancha panchaka, students will finish the indriya pancha panchaka in single page. The rest of the 2 pages will be empty. So before starting the Indriya Pancha Panchaka, we need to plan. In first page, what I need to write. In second page, what I need to write. In last page, why this particular Indriya Pancha Panchaka is needed and where it is utilized and where it is used. And when we move on to the Manas Atma, the basic questions what I receive from my students is, so the Atma Mana, what we study under Padartha Vijnana, and what Atma Mana, what we study under Kriya Sharira, the both are same or no? Yes, exactly, it's the same. The only thing is the practical applicability or practical utility or the practical functions we'll write related to Manas. And when we are concentrating about the philosophically origin of Manas and Atma, we will study under Padartha Vijnana. Even you can include both the topics and you can form your own answer. But don't forget the important point should be in that, like functions of mana, gunas of mana, and types. That is the important topics which are mainly concentrated on manas, like anutvam and ekatvam. It should be mentioned there, and some nyayas related to those manas. It should be mentioned. The karmas of manas. It should be mentioned, and vishayas of manas. It should be mentioned, and origin of manas. It should be mentioned. Apart from this, you can add your own thoughts by including Padartha Vijnana as well as Kriya Sharira. There is no such a like Manas related to Padartha Vijnana is completely different. The Manas or Atma related to Kriya Sharira is completely different. The next, when we move on to the Nidra and Swapna. So Nidra and Swapna are basically asked for 5 marks questions, where there is a direct question, Nidra and its benefits and its types, Swapna and Swapnotpatti, and the time taken for the particular Swapna where it becomes true. So these are the basic few questions or important questions which are basically asked under Ayurvedic part. Apart from this, you go to your syllabus, there might be some questions will be mixed under. Sometimes what happens, uh, the Manas. So there might be no question related to Manas for 5 marks. And they might ask Nidra for 5 marks and Swapna also for 5 marks and Atma for 5 marks. So there is no such a rule, but you need to concentrate the Manas and Atma, Nidra, such questions will come for 5 marks, right? So next, when we move to the modern aspect, the first, which includes both Kriya Sharira paper 1 as well as paper 2. The topic included here are homeostasis, respiratory system, GIT, CNS, endocrine, hemopoietic system, immunity, cardiovascular system, muscle physiology, adipose tissue, reproductive system, excretion, special senses, sleep, and dream. So the most expected questions in the homeostasis, as they all know that homeostasis, explain homeostasis in detail. The question will be for 10 marks. And here we can also we can also expect the question like transport across through the cell membrane. As in first chapter, there the 5 marks or 10 marks question will be from transport across through cell membrane, direct questions. And when we move to the respiratory system, the most favorite question in the respiratory system is regulation of respiration. So when we move to the previous year question papers, it is asked twice. Regulation of respiration, and we'll also the other question also like physiology of respiration, how the actual inspiration and expiration, actual the cycle takes place, and also there will be a question like lung volumes and lung capacities. When we move to GIT, as it is a vast topic, the most expected things will be from the movements of GIT. and one of the secretions, like explain gastric secretions and its applied aspect. Explain salivary glands, its secretions and applied aspect. When we move on to movements of GIT, the most favorite or expected question always is deglutition. Explain deglutition and its stages, or sometimes defecation reflex. Movements of large intestine and small intestine. The movements of large intestine and small intestine is combinedly asked. So basically concentrates on each and every secretions with basic diagrams and its function, and last we need to concentrate on applied aspects with diagrams. When you move to CNS, it's a vast topic. There is no such a expected when we have the recently in the RS7 batches, there will be cerebellum, and there was a questions related to spinal cord and nerve fibers, classification of nerve fibers. There will be some combined questions if it comes for 10 marks. If it comes for 5 marks, there will be a single question. For example, if it comes for 5 marks, it will be cerebellum or it will be a spinal cord. Example, it's an example, not that the next in tomorrow examination it will be a spinal cord or cerebellum. When you move on to 10 marks question, they will combine one question with other questions, so it will be easy for splitting and for writing purpose. When we move to the endocrine, the most favorite questions are like explain thyroid gland in detail, its hyper and hyposecretions, explain pituitary gland in detail. So when we move on to the 5 marks question, we can expect like pancreatic endocrine part of pancreas and adrenal glands. So the usually in when we concentrate on RS7 batch question papers, the most expected question is pituitary gland and thyroid gland for LAQs. The remaining questions will be by for MCQs. Oh, sorry, SAQs. And when we move, the next topic is hemopoietic system, where we can expect the erythropoiesis, leukopoiesis, coagulations of blood, and clotting factors. So these are the expected question for 5 marks. And 10 marks question we can expect here is erythropoiesis, and with combined its factors responsible for erythropoiesis with a neat label diagrams. I will show you next upcoming pictures. When we move to immunity is a direct question which is mainly asked for 5 marks. There will be no long questions from immunity. When we move to the cardiovascular system, the favorite questions are like cardiac cycle, explain cardiac cycle in detail. In last previous year only they have asked like explain cardiac cycle in detail, explain cardiac output and venous return, explain ECG for 5 marks, and regulation of blood pressure for 5 marks. So the students will be having confusion. What do you mean by blood pressure and what do you mean by arterial blood pressure? Because in our syllabus copy, it's like arterial blood pressure. If the question is asked for regulation of blood pressure, the same answer will be written as that of the regulation of arterial blood pressure. When we move to muscle physiology, there will be a 5 marks question. The most expected question in muscle physiology is contraction of muscle fibers. When we observe the previous year question paper, the most expected or asked the most loud question is contraction of muscle fibers. So when we move to the adipose tissue, it's basically a direct question, 5 marks question. Adipose tissue, its functions, its depositions, its types. When we move to the reproductive system, the most expected 2 questions are oogenesis and spermatogenesis. Those questions will be for 5 marks. When we move to the excretion, in excretion there are 3 questions like formation of urine, micturition reflex, and concentration of urine. These are the 3 questions which we can expect from the excretion. And when the last thing is special senses, sleep and dreams. When we concentrate on sleep and dreams, we'll get only 5 marks questions. When we move to the special senses, we can expect 1 LAQs from 4 special senses. So where we can define it as in the different manner, like introduction we can write with diagrams and with applied aspects. So when we move to the sleep and dreams, there will be no LAQs questions related to sleep, and there will be no LAQ questions related to dream. We can directly concentrate on 5 marks questions, like we can write their classification of sleep, how the cycles of sleep takes place, like a rapid eye movement and non-rapid eye movement sleep, so that we can concentrate on different steps. But basically you remember at the last point, the only 10 marks question will be from special senses. There will be no 10 marks questions from sleep and dreams. Next, we'll move on to the third part of my presentation. We'll move on to the third part of my presentation, that is how to write the answers. This is the actual game changer of the paper. Usually what happens, the students who know everything, sometimes he will not score good marks. The students who is average, he will score good marks because of his presentation skills. Because presentation is a game changer thing, where we can score more marks with less knowledge or less number of matter. We can score more marks by presenting the answer in the better manner or in the beautiful manner. So when we concentrate on LAQ, that is long answered questions, the presentation style will be, initially we will have the introduction with reference. I'm speaking introduction with reference, detailed explanation with clear headings and it should be underlined, and tables if it is required, and diagrams if it is required, and applied aspect. Applied aspects plays an important role here, and conclusion with modern correlation if possible. Because if the question is asked for 5 marks, or if the question is asked like enteric nervous system or samanavata, or if the question is asked explain types of vata dosha in detail, so you will write introduction towards vata dosha with a reference or in a detailed explanation of subtypes of vata dosha, and you will write a shloka and you will write the meaning, and you will have a tabular form which vata dosha will resides in which place and its function, and diagrammatic representation like Udanavayu, it's mainly responsible for speech production, and Apanavata is responsible for movements of Grahani. So we'll have some small diagrams in the rougher manner, and applied aspects you will write. In the conclusion, you will give some small modern correlation like Pranavata is be correlated with the brainstem, and Apanavata is correlated with the enteric nervous system. Sorry, Samanavata is correlated with enteric nervous system, and Udanavata is correlated with the speech production, so and speech center, which are mainly present in the central nervous system. So these are the possible things which we can include under LAQs. So the presentation should be, should include introduction, detail with reference, and detailed explanation with headings. It should be underlined, and we need to have some tables, and we need to have some diagrams, and we need to have applied aspect, and at last you need to write conclusion. Writing conclusion in the LAQ will add 1 or 2 marks to your answer. Usually what we do, we start from the first page and we end at the 6th page. There will be no segments of the answers. So dear students, what we need to do, we need to concentrate in this pattern, and don't forget to write conclusion in the LAQs. The next part is SAQ. SAQ, it is a shorter form of LAQs, where we'll include definition, we'll write some of the classifications, and we'll write some of the functions related to that particular questions asked, and we'll write some clinical importance, and we'll write some diagrams if needed. There is no need of modern correlation in SAQs because the time required here is less, and the requirement of the allotted marks is only 5. So we need to concentrate on distribution, where it is actually, or how the marks will be distributed. For example, if the same question of vata dosha is, and its types is asked for 5 marks, you'll write only definition of vata dosha, we'll write the classification types of vata dosha, we'll write direct function of vata dosha, and we'll write subtypes of vata dosha, and we'll write it clinical importance with some diagrams if required. And there will be no correlation. When we move to the modern aspect, if the question is asked for homeostasis, we'll write the definition of homeostasis, the classification or components of homeostasis, and we'll write the feedback signals, negative and positive feedback signals, and with the example and the different systems involved in the homeostasis complete. When the same question is asked for 10 marks, we need to explain in detail. Okay. The next one is shloka strategy, where many of the students will face some difficulties. Usually what we need to do is learn some major shlokas from major topics, or learn one or two shlokas from major topics. So if the question is of Avastapaka, we need to learn 3 shloka. It's mandatory. When we move on to the Ahara Parinamakara Bhavas, we need to learn 6 small shloka. That's enough. There is no such a rule that we need to write each and every shlokas which has been explained in the Kriya Sharira. No. So learn some major shlokas which basically related to that concerned topic. And even some partial shlokas also fetches some amount of marks. Like for example, Vayu Apakarshati, Tapa Santape. है ना? So these are some small shlokas where we can add, and you need to underline such shlokas that will add on marks to your answers. There is no such a rule that we need to, if you write 3-line, 4-line shlokas, then only you will get a marks. No, even if you write small shlokas also, you can earn marks. And the next important point is write source names. Sometimes what happens, you won't remember the particular sthana, or you won't remember the actually from where the shloka has been taken. There you can directly mention, like according to Charaka Samhita, or according to Shushruta Samhita, or according to our Ayurveda Acharya, or according to Charaka Acharya. You can directly mention there. And if you don't know the sthana, if you don't know the shloka number, you have such a freedom, like you can mention the source, like it's directly taken from Charaka Samhita. So we will, as your first year, will that can be considered, and it will add much more marks. And these all above said things will boost your answer quality. Even though there are 1 or 2 points missing in the definition, 1 or 2 points missing your functions, that will be covered by your shloka strategy. The next one is diagrams. There is no such a rule like that it should be a complicated diagrams which with need sketched and all. No, practice simple diagrams as much as possible. Practice simple diagrams, because in the initial stage we have hardly 1 or 2 minutes to have a diagram, and for that purpose we need to have a simpler form of diagrams. And just keep in mind, diagrams are nothing but your free marks. If you write 1 page of stomach, and if you have 2 diagrams of stomach, it's more enough. They are both are equal. If you write 1 page of uh, urine formation, and if you write 1 page of neuron or 1 page of nephron, the if you have 1 or 2 diagrams of neuron and nephron, it adds more marks. If I am giving for 10 marks, I am giving for the complete description 7 marks. By seeing those 2 diagrams, I'll come to a conclusion that, okay, if the student is capable to draw such a diagram, then he can write the much more topics or much more elements related to that particular topic. So it will add free marks. As earlier I said, even rough diagrams will give you 0.5 to 1 marks. Sometimes suddenly what happens in last 5 to 10 minutes, students leave by using a pen. He will draw some or the other diagrams, small diagrams related to stomach, small diagrams related to erythropoiesis, small diagrams related to brain, small diagrams related to eyes, ears, small diagrams related to pathways and all. So those rough diagrams will add 0.5 to 5 marks. Consider if you have drawn in and around 10 diagrams, you will score 5 marks. If I give 5 marks only, you'll score 5 marks. So consider we have more than here 8 questions and here 4 questions, 12 questions. In each question, if you draw 2 diagrams, 24, it means 12 marks you are gaining freely with the diagrams itself. So dear students, concentrate on diagrams which are very simple and very easy to remove without consuming much time. The next one is last 7 days preparations. It is much more needed because the exams are within these days. The things what we need to do during these last 7 days is only revise high yield topics. It doesn't mean that it's last day, last 7 days are remaining, or last 6 days, 5 days, or tomorrow I have exams, I'll revise from the topic 1 and I'll read till last. No, you should not do such blunder mistake. We need to concentrate on only high yield topics like LAQ and SAQs. And we need to memorize the definition and tables, because before writing we need to sit and recall, right? So that for recalling purpose we need to know For this question, these are the tables. For this question, these are the definitions. It should be under your concentration. And practice writing speed. So usually what happens, whenever you enter from plus 2 to the BMS first profession, there will be much more writing, because we need to write the Sanskrit shlokas, we need to write its explanation, we need to give the tables, we need to have the diagrams. So what at the end of the first or two papers, the students feel like after completion of 2 hours, the complaint of student is, sir, my hand is paining. They will sit for 5 to 10 minutes, again they will start writing. So that should not happen. So as we have still 4 to 5 days for the examination, so what the students should do is, they need to have some continuous writing practice, at least for 2 to 3 hours. Solve previous year question paper, so that you'll get an idea the what are the strength required to write the complete 3 hours paper. So this is the thing. Only revise high topics, memorize definition and tables, practice writing speed. The next is, the most important thing is, the most common mistakes to be avoided in the examination, especially in the Kriya Sharira. The first thing is writing model physiology only. Because if the question is asked for Ahara Paka, if the question is asked for Ahara Paka for 10 marks, the student will be knowing Ahara Paka is nothing but the digestion process, how it starts from mouth and ends at the rectum or anal canal. So he don't know anything related to Ahara Paka. Only he know the translated word, that is Ahara Paka refers to the digestion. What he does is, he'll initially write Ahara Paka is considered as the process of digestion. He starts the digestion process. He draws the complete GIT. He starts writing something related to stomach, something related to its secretions. So that should not be done. Only the modern physiology will be included in the modern part, or if you are using the modern physiology in Ayurvedic part, it should be only meant for the correlation purpose at the conclusion part. Okay, so don't do such blunder mistakes. According to you, you have completed each and everything, but according to the examiner or evaluator, you have written complete 0, because the question asked is Ahara Paka, you have written digestion process. So you'll score 0 marks. So for that purpose, before writing, plan your answers. And the next point is, no structure, long paragraphs. So what we need to do, so there should be a complete structure. Sometimes what happens, the students will have the tendency, nowadays we are observing, they will draw one margin this side, they will draw one margin this side, and they will start writing in between, so that they will feel like, so I have completed complete answer sheet, I have filled each and every line. So those things will never add on, those things will not give you complete marks. And long paragraphs, always you will lose the marks there. So what we need to do, we need to have some particular points. Rather than writing a long paragraphs, we need to make it shortcut, like introduction, methodology, and then conclusion, or some tables and all. In next upcoming slides, I'll show you how to write, how the paragraph answers looks and how the splitted answers will look. And skipping applied aspects. Usually students, what they will do, if the question is asked for salivary glands, they will write every point of salivary glands, and at last they will skip the applied aspect. This applied aspect of each and every system will add 1 marks. This repeating, this applied aspect of each and every systems will get you 1 marks. So with writing each and every point without writing applied aspect, you are losing 1 marks. So it's hardly 1 or 2 lines. So students, what we need to do, we need to concentrate on applied aspects also. And no Sanskrit terms. So the maximum students will follow this. Around, I think so, around 60 to 40% students will follow the last thing. No Sanskrit terminologies. Like if the question is asked for the qualities of Vata dosha, it's Tatra Ruksha Lagushita Karasukshmas Chala Anila. So they will not write this thing. They will write the qualities of Vata dosha are, it is dry in nature, it is cool in nature. So that is not recommended in the Ayurveda part. Even you are writing in the English, write it as Ruksha. Don't write it as it's dry. So the Ruksha terminology is completely different and right terminology is completely different. So these are the common mistakes which students should avoid while writing your university examinations. The first thing is writing modern physiology only. It should know structure and long paragraphs, skipping applied aspects, and no Sanskrit terms. So these are the basic four things where students should avoid the mistakes. And the next important thing is how the questions will be in the university examinations. By after referring the many question papers, I have formed some questions like the questions will be like describe nirukti, sthana, guna, karma, and types of pitta dosha. Okay, and it might be the same questions related to vata dosha and same questions related to kapha dosha. So in previously I said there will be no pitta dosha related to 10 marks. Intentionally I have written it here so that students will be more familiar with these things. So the distribution marks, if there is for 10 marks question, the 1 marks will be given for nirukti, 1 marks will be given for sthana, 1 marks for guna, 1 marks for karma, and 1 marks for types. And explanation of those types will get 5 marks. The students, what they will do, while writing nirukti, they will write, while writing sthana, they will write. If they are struck in guna, they will be starting thinking on what's the guna of this particular vata dosha. What's the guna of vata dosha? They will start thinking. It will eat your 2 to 3 minutes. If you are not getting guna, just leave it off. Move on to karma. Move on to types and words. So in 10 marks, you have not written only 1 marks, that is guna. The remaining 9 marks have you written in the correct manner, so that there is a possibility of scoring 8 marks. Rather than strucking in the particular guna, we'll leave it. In last 5 to 10 minutes, we'll discuss or we'll think about the gunas of vata dosha. So you can recall that at that time, rather than strucking the particular our important time under this thing only. So that will lose your confidence. First thing, that will lose your time, or that will eat your time. And then rather than eating the same question, it will eat your next upcoming question also. So the next asked questions will be probably like this, describe the composition and functions of gastric juice and pancreatic secretions. See, here the question is asked, describe the composition and functions of gastric juice and pancreatic secretions. So there will be distinguished 5 marks will be given for gastric juice, 5 marks will be given for pancreatic secretions. In that 5 marks, you will be observing the composition, its function. In pancreas, composition, its function. So it's completely divided. So usually whenever there is a LAQs, we need to see the distribution of marks. Okay, in the same way, the question is asked like describe the types of kapha dosha. It's a direct 5 marks question where we'll start directly from kapha dosha. The types of kapha dosha, they're basically fine number, and you need to explain each and every kapha doshas in detail. And see, in previously I said the avastapaka, it's the most favorite question in the ahara. Deglutition and its stage, it's basically very important in our moments of GIT. And explain vriddhi and kshaya of three doshas. So these are the most favorite or most recently or most frequently asked questions. See, now we move on to the demo. How to write the examination paper. The first question which is asked is it is an example, right? Explain vriddhi and kshaya of three doshas. It's a question which is asked, and normally each and every student will answer it as they will write the shlokas or the concerned shlokas related to vata vriddhi, concerned shloka related to kapha vriddhi, and concerned shloka related to pitta vriddhi, and its reciprocal kshaya, and it will be followed by its explanation. So is it okay to get all full marks? No. Usually what happens, we will miss the basic entity. So as you all know, that if the question is asked for 5 marks, you all know the 5 marks includes 3 pages, and the complete shloka and explanation will carry, or it will eat only 2 pages. The remaining page, so it will be empty, and at the end we will strike out. No, you should not do like that. The answer of this will be written in this manner. The initially we will start it as dosha. We have the classification, that is nothing but how the presentation of the answer should be of vriddhi and kshaya. Like the dosha, the classification of dosha, it will be classified into prakrita dosha and vaikrita dosha. And this prakrita dosha will lead to swastha, that is healthy person, and this vaikrita dosha will lead to dosha vriddhi, and dosha kshaya. Vaikrita is nothing but pathological conditions, and dosha vriddhi and kshaya are pathological conditions. This dosha vriddhi, again it's divided into dosha sanchaya, dosha prakopa, and dosha prashamana. Now the question is vata, pitta, kapha, vriddhi, kshaya. So beside that or behind the dosha, we will add just vata. Vata dosha is divided into two categories: Prakrita Vata dosha and Vaikrita Vata dosha. This Prakrita Vata dosha will be responsible for Prakrita functioning of Vata dosha, and this Vaikrita Vata dosha is again divided. It will be responsible for Vata dosha Vriddhi and Vata dosha Kshaya. And the next Vata Sanchaya, Vata Prakopa, Vata Prashamana. And then you need to write the Vata Vriddhi Shloka and Vata Kshaya Shloka, and you need to explain. The same will deal with Pitta dosha, the same will be with Kapha dosha. The next important or the most favorite question is questions will be like muscle contractions. So whenever the question comes like muscle contraction, the students will start writing from a neuromuscular junction, types of muscle fibers, and they will be writing in the paragraph manner. Rather than writing this, if the question is asked for muscle contraction, you have these two such a beautiful flow charts. These two flow charts are enough for explaining of muscle contraction, and the examiner will be happy to give you full marks. And we need to include for this, we need to have some introduction and we need to have some conclusion over this. Why the muscular contraction, and what are the stages involved here, and what are the things that are like the neuromuscular junctions, and you need to highlight these things in the initial stage, and we need to concentrate basically on these two flow charts. So your exam point of view, according to Ayurveda, it should be in the that part. When you move to the modern part, it should be in the such a क्या बोलते हैं इसको flow chart. It should be in the flow chart manner. The next important question is erythropoiesis. See, the same question with a different perspective. I have given the same question for two of my students. One student has written it in this manner. See, it's a complete paragraph manner where there is no structured entity. Direct question. So it will be very difficult for the evaluator to read and to search the particular important topics. And the other student which I have mentioned in the thing is, see, the same question has been written in the different perspective. Here we have introduction, we have size, we have properties, and then the next is we have the 6 stages. In next page we have the 6 stages of erythropoiesis, and in next third page we have, see, the first stage with 4 headings and a small diagram. It's a rough diagram which is removed with the pen itself. And see, we have 1, 2, 3 diagrams, which the complete picture tells that the students has read the erythropoiesis in the complete understandable manner, and even he or she presented in the good manner. So it is, see, when I'll show the another time. See, when we concentrate on this erythropoiesis, and when we concentrate on this erythropoiesis presentation will yield more marks compared to this erythropoiesis. So this is how the presentation matters. Okay, this is how the presentation matters. So usually before presenting or before writing any of the answer sheet, I said first 2 minutes is mainly meant for structuring your answers. Before writing answers, we need to have these things. So we have a quote like, before starting, we need to know how to or where to finish it. So before starting answers, you need to know at this page this will come, and at this page this will come, and at this particular diagrams will represent at last pages. So this is complete 10 marks question, which includes complete 6 pages. The last thing is tips. Tips for the exam going students. The first basic thing is the candidate should be 30 minutes before the exam starts. So that is nothing but the candidate should be in the examiner hall or in the complete campus before 30 minutes. For first years, usually the examination starts at exact 9 o'clock, so that you should be in the examination hall or in the center exactly before 8:30. And the most important thing is you need to carry a hall ticket with you, and it's mandatory. And also you need to carry your ID cards. and you should use black ball pen, and it's mandatory. So initially you need to carry 2 to 3 black ball pens, and carry pencils, erasers, and sharpeners if needed, so that you can have a rough diagram initially, and you can have over you can rub that out, or you can have the complete sketch over the your answer sheet. So what are the things you need to include in these minutes? After that, you can rub it, and read the instructions or follow the instructions given by the invigilators before writing. This is important, because as you are appearing the university examinations for first time, you need to read the instructions given on the answer booklet, or if you have any doubts, you can directly ask the invigilator, sir, what are the things should be filled, and what are the things should be encircled, and where I need to sign, so and so. And fill the credentials very carefully, because your this it's your paper, it should be recognized by your credentials. So where we need to write the QP code, your signature, register number, your name, and also you need to write which phase, or that is BMS first phase, and which paper you are going to write, like Kriya Sharira paper 1, Kriya Sharira paper 2, right? And eat light food and stay hydrated. This is very important. Students, what they will do during examination 8:30 in the morning, the students will be in the tension, so they will come with the empty stomach. After seeing question paper, or after writing, after 1.5 hours, they start sweating, they start shivering, and there will be a headache, and they will be asking like, sir, I need some water, or we need to have, I need to have some eatable things. So dear students, before entering into the examination hall, eat light. And it doesn't mean that sir told to eat, so I'll have much more heavy substances like guru ahara, that will induce sleep, that will cause drowsiness in the examination hall. So that eat light food and stay hydrated, stay calm and focused during examinations. So these are the some important tips which students should be followed. And not to carry, and this is the utmost important, cell phones, smartwatches, books, or any cheats, and small bags are not at all allowed under the inside the examination centers. Usually, the last one is small bags. The usually the female students or girl students will be having tendency to carry small college bags, which includes water bottles, compass, pockets, or the pouches and all. So those are not completely allowed inside the examination centers. So if you are having all those things, it should be kept outside the examination halls. Smartwatch, so you can use watches which are digitally, or which is manually used, because what happens, sometimes your smartwatch will be connected to your mobiles, which is kept outside the examination center. If there is any notification, there will complete notification will be blinked in your smartwatch. So that complete utilization of all these four things will be considered under malpractice case. So it's better not to carry cell phones, smartwatches, books, or any cheats, or any bags. So I wish you all the best for your next upcoming university examination. Give your best, stay focused, and you can achieve it. Okay.
Thank you, sir. Thank you so much for the session. Session will be
So
definitely useful for the students, sir.
and
Especially for the first BMS, sir.
I take this
Uh,
opportunity, ma'am, to thank you for getting me this opportunity to share my knowledge. And I also thank your complete entire team, because I'll be watching your videos, I'll be watching your post texts. It will be helpful for first year, second year, final year, even for post graduation. And even some of the teachers will also be beneficial by this thing. So I'll wholeheartedly thank you once again for getting me opportunity to share my knowledge. Thank you.
Thank you, sir. Thank you so much. You're very detailedly explained everything, sir. Each and every aspect, very little things that matters the most for the students, sir, nowadays. Especially for first BMS, they will be very confused about their RS7 regulations, sir. It is very new to them, also for
Yes,
teachers
RS7 and
also.
RS6, there will be slight clarification.
Yes, sir.
Okay, okay. Yes, yes,
Uh,
exactly. So that I was concentrated on what are the actual time required also and how to structure it.
yes, sir. We hardly get the gurus who guide us in these aspects, sir, which students need the most nowadays. As from the team Panchajanya, we are
And
very
see,
glad to have you in this
the main
session today.
motto of the teacher is, uh, okay, thank you, thank you. Is it okay then I can stop my sharing the screen?
Yes, sir. Yes, sir.
Okay, thank you.
We'd like to do more collaborations with you in the future, sir. Once again, on behalf of our team, I wholeheartedly thank you so much, sir.
Sure, sure, sure. Always 24 bar 7 ready for Ayurveda. Thank you.
Yes. Thank you, sir. We'll wind up the session now, sir.
Okay, madam. Okay, thank you.